Dr. Wolski, somewhere, I think it was on television anyway, I've heard that word RSD. Apparently people have all kinds of pains or whatever. Can you explain that? It seems to be a new nomenclature coming up there. Tell us in layman's word what that means and how it can be treated.
Yes, this has been getting a lot of publicity because Paula Abdul was diagnosed as having RSD. What this is a very unusual type of illness. They really don't know what causes it. They think it's due to a malfunction of the nerves, a dysfunction of the nerves. The nerves just aren't working right. What these folks have, they have chronic pain, usually in the hands or legs, and a lot of times they go from doctor to doctor trying to get a diagnosis, and a lot of doctors think these folks are crazy or and that their pain isn't real, but it is real. We've had patients. I had a patient with trivial injuries. Often these will come from trivial injuries. I had a patient where she hit her wrist against a doorknob, and afterwards her hand started hurting. It started swelling. It started turning purple and blotchy. The skin got shiny, and then it got flaky. And her arm swelled up to her shoulder, and it hurt her so bad she said that please cut it off. And she had to wear a sleeve on it to keep the swelling down, all the way up to her shoulder. And what we did was we treated her with some stellate ganglion blocks, which help. These are injections into the neck to a clump of nerves called the stellate ganglion block. It blocks these nerves that aren't working right, and it relieved her pain in her arm. Her swelling improved, and we were able to do physical therapy. Before this injection, if you just barely touched her skin, she would almost jump back because it's incredibly painful. If light pressure was out of the question, she couldn't shake anybody's hands, and her hand would sweat all the time, and she had to just have a cloth to dry the sweat in her hand. But we were able to document that this is what she had. We did a bone scan. We have a thermogram in our office, which very few doctors have, and we were able to show a temperature difference, which is one of the criteria for RSD, or reflex sympathetic dystrophy. We were able to put her in our pain management program, and we did a series of those stellate ganglion blocks into the neck to relieve her pain, and she was a lot better after she was finished. We were able to increase the strength. She couldn't even hold a glass in her hand because it was painful, and she just didn't have the strength. But we've got people like this who have RSD. The other name for RSD is complex regional pain syndrome. It's another name for it. But we have patients like this that benefit from our diagnostic testing and from our therapy, our chronic pain management therapy.
Compared to other pains or other symptoms a body might have, be it after or before an accident or just getting old or whatever it may be, I mean, how does this complex pain system, how does a person kind of think I might have that? You know, when a person starts having a sniffle, he goes, I might have a cold. He knows what that is. Or how does a person diagnose that? Or is it not important for him to diagnose? He has pain, he'll come to you anyway. It is really just up to the medical doctor to figure out what the heck that now is.
Well, it's usually pain that lingers on way beyond the initial injury. And like I said, an injury could be trivial. I had another lady. She was shocked, plugging in her vacuum cleaner into the wall. And one of the strange things about RSD or CRIPS, it can spread to the other limbs. This lady's arms started swelling, then it jumped to her other arm, and it jumped to her legs, and this lady was in a wheelchair from electric shock. Her limbs were swelling. They're turning purple, blotchy. So basically, what brings this people to us is they've had pain just that lasts way beyond the initial injury. We get patients that have carpal tunnel syndrome, and they end up having this injury. We have people who have crush injuries, and long after the crush injury should have healed, they still have this complex regional pain center that have this excruciating pain to even the slightest touch or the slightest pressure. Some of them are so bad that they just kind of recoil if you come near them because they can't stand the pain of being touched. But what it is it's just like an unexplained pain that just lasts for way past the duration of the initial injury. Right.
Well, those are obviously the ones we all need to be paying lots of attention to. I mean, it's kind of like not so unusual, and it's obviously not funny and not necessarily dangerous to have pain after you hit yourself with a hammer on your toe. I mean, that's a rather normal thing. You wait till it goes bye-bye and it's all done and over with. But, if 3 months later you're still hurting, obviously something else was damaged somewhere along the line. The body got some shock and the nerves are stuck and something isn't working, and you better go and fix it. All right.
Well, these people.
Go ahead.
Okay.
No, go ahead. Tell me what you want to say.
These people can hurt for years after an injury, and it could be lifetime. And it's a very debilitating disease. Yeah. And a lot of these patients get misdiagnosed.
Which I think is exactly the reason why some of us give up. We go to maybe one or two doctors, maybe not even specifically. We just like on our next examination mentions I always have pain, and next thing you know is the doctor says, well, you're not getting any younger. That's kind of what it is. I can give you some painkiller. Let's observe it. And next thing you know is the patient, we get used to certain pains. Oh, I can't do this. Oh, I can't do that. And it's kind of, we basically, become a dimmer switch syndrome. We get used to it when, in many cases, it just simply doesn't have to be. That's what you're saying, right?
Correct.
Yeah. Well, I hope that informs some of the people out there that if they have some particular illness which lasts above and beyond than what it should have based on the original injury, or even if they don't connect it to an injury or to something, because as you said, the injury was tribal, you probably don't remember and say it came from that. And just go and seek out people who can fix, because I really, think that lifestyle is what we're after. I mean, long living, fine, but whatever the years we live, we should at least be able to have a decent lifestyle. And as you clearly said, when we have pain, and we all notice that, be it for a week or whatever, for a longer time, if we have pain, our capacity of producing, doing our work well, loving our family becomes inhibited, because we have so much energy to use to just, not get frantic from our pain, that very obviously we sleep less, we are less rested, we are, all kinds of things, and life, it just snowballs or spirals, so to say, into not doing well. Simply, when our bodies don't do well, we don't do well, and we become, who cares about more career or about more this or more that? I'm having pain, and we should fix it. Dr. Wolski, thanks for letting us know.
You're welcome.